So there are a number of reasons why wisdom teeth need to be removed. And the first thing that's important to understand is we like to see patients around the age of 15 or 16 years old to evaluate the wisdom teeth. There's a common misconception out there that, until the wisdom teeth start breaking through the gums, there's no reason to get them checked out. Well, the reality is that when that happens, the wisdom teeth are already fully developed most of the time, and that makes the procedure much more difficult. There are more potential risks and a longer recovery. So the advantage of seeing someone at 15 or 16 is we can do a clinical and radiographic examination, and we can determine, what issues, if any, are there. Is there enough room for the teeth to come in the mouth all the way? If there is, and they don't have a high decay rate, they may be fine with their wisdom teeth. If it looks like there's minimal space and they're only going to make it in partially, those are the teeth that have a very high likelihood of having problems in the future. It may not be till you're 25 or 30 years old that you develop decay or an infection, or it's caused damage to your second molar. But as I said, at that age, it's a much more complicated procedure. So during the consultation, that's when we educate the patient. We tell them what is going on, why we think the procedure needs to be done. We're not just telling them, look, you need to have this done. We're giving them reasons why, what are the indications. And then once we show them it needs to be done, we're explaining to them what the procedure involves. So during the treatment process, that's the actual surgical appointment. Our assistant will bring them back and they'll confirm that they have not had anything to eat or drink in the last 8 hours. And then they'll hook them up to the monitor so we can watch their vitals very carefully during the procedure. And then the doctor will come in and we'll start an IV and we'll administer the appropriate anesthetic that we've pre-discussed on what they want. And once they're basically under anesthesia, we'll remove the wisdom teeth and place dissolving stitches. And I would say the average wisdom tooth surgery takes about 45 minutes.